Spring greetings. Hello, I'm Kim Meredith, CEO of the San Francisco General Hospital Foundation, and I am truly delighted and excited to host you here today for this briefing. Our vision at SFGHF is that everyone deserves access to exceptional health care, and our mission is that we fund and support patient care and innovation at Zuckerberg San Francisco General Hospital because we believe in health equity, access, and care for all. Thank you for joining us here today. Your support enables the life-changing work that happens day in and day out at ZSFG during good times and during challenging times. So thank you. Today, we are honored to have special guests, Chris Lehnertz, President and CEO of the Golden Gate National Parks Conservancy, and Dr. Amy Beck, Associate Professor of Pediatrics at UCSF and co-director of the Pediatric Obesity Clinic at ZSFG. So I am a huge believer in the healing power of getting outside. Most days of the week, I start my morning with a run to connect with nature and to level set for the day. During the pandemic and while working from home, this has become even more of a priority before I'm face-to-face on Zoom for hours all day. Something that many of you, I'm sure, can also relate to as you are working to juggle work, family, and the community. With so many restrictions on our movements in the past 2 years, getting outside safely for exercise, sunshine, and fresh air has never felt more important. While a different pace of life allowed some of us to experience the bounty of local parks in the Bay Area, we also saw the loss of school playgrounds and healthy activities for our school-aged neighbors. So Chris, welcome. You have extensive experience managing our country's most iconic national parks, as well as making parks relevant and accessible to all. How has the Golden Gate National Park Conservancy helped support people's access to parks during the past 2 years of living through this pandemic? And have you seen volume go up, or did somehow it stay down because people were indoors?
Kim, thank you so much for having me here today. It's great to be here with Dr. Beck, and I could not be more happy than to talk about nature, the connections that we need to have to make our lives healthy and happy, and be able to talk about the benefits that are real and studied and not just perceived. So a little bit about the Parks Conservancy. We're the nonprofit partner that supports the National Park Service here in the Bay Area. So if you ever go to Ocean Beach, if you've been to Alcatraz, Muir Woods National Monument, Fort Funston, these are all locations within the Golden Gate National Recreation Area. And for 40 years, the Parks Conservancy has been the partner to the national parks to do a couple of things. One, improve these parklands to really make sure they reflect that national significance of the parks, the open space, the history, and then also, really importantly, to connect people with the parks. So when we saw the pandemic happen, we knew that that connection during a time when people were told to stay apart, in some ways almost to stay away from parks, right? To be separated, that it was a time that we really wanted to activate the parks in a way that they could be there for people's mental health, their social health, their family health. So for example, we started working with our partners at the National Park Service just on things like enjoy parks 6 feet apart, being able to message the things we needed to do to be out in parks. Park managers really struggled. Bring people to parks, but close playgrounds. Ask people not to crowd parks, but know that among the most important things people did was get outside. So I would say over the course of 2 years, that arc changed and people chose to go outside, to be in nature, to visit national parks. So international visitation was down because we weren't getting on airplanes, but local and regional visitation was up. What we saw also is places that we had created, Crissy Field, celebrating its 20th anniversary, was activated like crazy. During the pandemic, people took those places where we had made progress in improving parklands. We also spent time building new parklands, the Presidio Tunnel Tops. A new area of 14 acres of national park will open in July. That is a place where the Bay Area came together. We were really honored to be the fundraisers for that. We raised $98 million. And those parklands will open because of the generosity of Bay Area donors in July of this year. So a lot of activation, a lot of demand, and a lot of joy that people saw with the benefits coming from being out in nature.
Such a great example of public-private partnerships.
Yeah.
Being with the public hospital, we definitely, we're all for that. So what a great story, Chris. Now, what I am curious about, and you have a little background piece there behind you, do you have a favorite place or view that you want to recommend to us?
Oh, yeah, there's so many, right? When you look at over 35 sites in 84,000 acres, it is an extraordinary collection of historic, natural, scenic wonder, the most threatened and endangered species in the lower 48, here in an urban setting, in the middle of an urban setting. I would say, and no one will be surprised who works with us at the National Park Service, Parks Conservancy, my favorite is Fort Point National Historic Site. And the view from the top of the tunnel tops, as a matter of fact, toward Fort Point is going to be fantastic. If you don't know where Fort Point is, if you look at the Golden Gate Bridge and you come to the south end of the bridge, there's a beautiful arch that Joseph Strauss, the architect of the bridge, put in to protect this historic fort. It was going to be razed, but he's like, no, we got to save that place. And it is the only what's called a third order fort on the West Coast. If you go in there, you can visit on the weekends. It is an extraordinary example, and the sunset cannot be beaten from Fort Point National Historic Site up on the top level. So my recommendation is Fort Point.
Wow. Okay. I hope everybody made a note of that. That sounds pretty special. Thank you, Chris. So now, Amy, let's turn over to you, Dr. Beck. With the sudden changes in routines and activities for children, such as not being on playgrounds, not having recess, and schools just being closed, what impact did these changes have on children's well-being?
So thank you so much. Thank you for having me and hosting me. And thank you for that question. I think we have seen a lot of both mental health impacts as well as physical health impacts. So I think, we do know that physical activity and outdoor time is very, very important for mental health. It's associated with lower risk of depression, anxiety, improved sleep, improved just sort of self-regulation. And we see those impacts on children just as we do in adults. So we did see quite a surge of increase in mental health diagnoses, new onset of anxiety, new onset of depression, a lot of shifts in sleep patterns and some sleep disturbance in kids. Of course, all of that is multifactorial, but I do certainly think that the reduction in physical activity and that outside time was a contributing factor. In terms of physical health, for our low-income population at San Francisco General, we saw tremendous weight gain, and then a lot of kids who developed new, what I would call comorbidities, so medical conditions associated with weight gain, so high blood pressure, fatty liver disease, prediabetes, and we've had an increase in our new diagnoses of type 2 diabetes in adolescents as well. I think in terms of the relationship between physical activity, probably the best way to explain, I can share sort of one patient anecdote that I think really highlights kind of the interplay of what was happening. And it was one of the first patients that I saw that like really raised my level of concern of what was going on. So it was a 8-year-old patient who we saw in our childhood obesity clinic. I think my first appointment with her was in June or July of 2020. And, her background story, she was an 8-year-old girl, living in a studio apartment in the Tenderloin. So they don't have great cooking facilities. And family history of, both of her parents have diabetes, in fact. So she was she was very high risk before the pandemic. They ate a lot of processed food because they didn't have great access to cooking, and then she had this family history. But despite this, pre-pandemic, she was maybe just slightly overweight, but no other health problems. And her sort of life pre-pandemic is she was a really, really active kid. So she went to an after-school program. After her after-school program, her mother would work until a little bit later, so her father would pick her up, and a few days a week they would go to the playground for an extra 1 to 2 hours. And she also swam at a local pool. She was swimming at least 3 times a week. And so when we added it all up, pre-pandemic, she was probably doing 3 to 4 hours of physical activity a day, which is really pretty optimal for kids. And so even though she didn't have a great diet pre-pandemic, and she had this really strong family history of, obesity and diabetes, she was a healthy kid. But then when the pandemic hit, all of that, that all kind of went away very abruptly. So no school, no after school programs, no playgrounds, and no swimming pools. That was something she loved to do. So the other factors didn't change, but just from taking away all that physical activity, she gained around 27 pounds just in the first few months. And this is an 8-year-old. So went from just being slightly in the overweight category to having very severe obesity, and developed high blood pressure. So this is what at the moment felt like an extreme case, but it's not extreme. And we have so many of these patients. And now 2 years in, we're seeing kids who've had 50, 60 pound weight gains over the past couple of years. So it is certainly an unfortunate, I apologize for my dog, certainly another component of kind of what people are dealing with during the pandemic, and children in particular.
So Dr. Beck, in terms of, that's a really powerful story that you shared, and some of the other data around children gaining 50, 60 pounds in a 2-year period. So what do you see as the long-term implications of this, both on the physical and the mental health? Are these children going to be resilient, and by getting them back outdoors and into a more of a regular routine, is life going to come back in balance? Or are you worried about sort of these longer term implications?
So I am worried. I think it's a little early in terms of the data. We do certainly have kids who, their growth curves have kind of went, and then they've actually lost quite a bit of weight since kind of getting back into their normal routines, resuming physical activity, sports, school, etc. And then we have other kids who haven't. A lot of patients, at least once they start intervention, their weight gain stabilizes, which is good. But it's hard when they've already gained so much weight. For most kids, we're not really seeing sort of a significant trend down closer to normal. But I think it will just take time to kind of understand, the trends and the patterns of what's going on. So, but definitely a lot of need for intervention and support to hopefully prevent the development of actual conditions, the diabetes, et cetera. So
thank you for that. That's definitely concerning, and it certainly reinforces this idea of the importance of getting outdoors in terms of health and healing. And hopefully we can see some resiliency for these children as they get back into life. So thank you for sharing that, Dr. Beck. Chris, when we come back to you, we've just celebrated Earth Day and National Parks Week. How does your organization promote the importance of our parks and the role they play in health, with some of the stories we just heard from Dr. Beck, and in building community? And what might be some examples of health care taking place outdoors, or some new iteration of how we might leverage that opportunity?
Kim, this is really my favorite time of year, when we get to April and people start to emerge right into nature, and it's National Park Weeks. Now, it might still be snowy at Yellowstone, but that idea that we all come together and think, what can we do? How do we plan our summer? How do we think about our trips? And that national parks are at the front door of a lot of that planning for families. The Parks Conservancy has really taken a lead role over the last 10 years or so together with the Park Service, and really as a part of a global movement. One is healthy parks, healthy people. So when we think about the connection, when we think about the idea of bringing people in connection with nature, that idea that a healthy park can be an inspiration to be a healthy person is really important. As a subset of that, there's a wonderful program called Park Prescriptions. And that's something that we've been working with. San Francisco has a terrific set of programs. East Bay Regional Parks has a program called Shine, spending health in nature every day. And the opportunity for doctors, for family care physicians, for others to think about, if I can get my patient outdoors, there are things that happen in the magic of nature, whether it's movement, it's solitude, it's peace, it's a dynamic socially. Time outdoors in nature, we know, reduces stress, anxiety, depression, blood pressure, feelings of anger. These are from studies that have been done. Dr. Nushin Razani has worked with us in doing studies about when you prescribe parks and nature outdoors, what it means. So those are some of the things that decrease. What gets increased when you go out into nature and national parks? Your focus, your productivity, your self-esteem, creativity, and your connection to parks and becoming a supporter of nature. So it's a wonderful cycle. The more you're in nature, the more these positives happen, and the more you'll advocate for the protection of parks and public lands. And that's the beauty of healthy parks and healthy people, is it's a cycle that fulfills itself. Being outdoors, you appreciate the outdoors, and you appreciate what the outdoors bring to your personal or social or family life. Those are a couple of things that we think are really important. Our purpose as a nonprofit supporting these parks is really to make those connections between people and parks. And we've seen in communities, we've seen social cohesion increase during the pandemic in public spaces. We heard visitors enthusiastic about going to parks and not even talking to another person, but knowing during this time of solitude or isolation, seeing another person, seeing another family, made this connection as people moved outside, birthdays, quinceañeras, family gatherings, weddings. It allowed us to have a place to connect and reduce the social isolation that was being felt across the Bay Area. And I just, another piece, Kim, that you mentioned is one of the priorities that you all have is access to healthcare. We have a priority for access to parks. So those fit together beautifully. I just want to talk a little bit, share a little bit of information. The Trust for Public Lands in 2021 did a study about how far are you from a park? When we think about a goal, the Trust for Public Land, and we share this goal, is that you should be within a 10-minute walk of a park. So a national park, you think about Yosemite, you think about Yellowstone, you think of places that are far away. In fact, bringing parks to people in an urban setting started 50 years ago, right here in Golden Gate in San Francisco. The idea that we would create national places where landscapes and seashores could be available to people that could be a walk from their house. This goal of being within 10 minutes of a walk to your house, San Francisco is 100% meeting that goal. 100% of the people who live in San Francisco are within a 10-minute walk. But here's the equity question. In neighborhoods of color, you're 36% below the median in terms of an opportunity of having park space. So it's not just the access, it's the space that's available to you when you visit a park. So neighborhoods of color, 36% below the median. White neighborhoods, 46% above the median. So we know that even though you're in a 10-minute walk, the access to the size, quality, and experience you can have, there's still a lot of inequity and access issues that are there.
So how are you addressing that inequity?
Part of what we're doing is making sure that we can go into communities and give them the opportunity to build some confidence around what it means to leave your own neighborhood, to visit a national park. It's not always easier, and there are barriers to access, whether it's an emotional, an experiential, or a transportation barrier. And we're working at all three levels. We have a wonderful park shuttles program. We have a partnership program with San Francisco Public Libraries, where we go into libraries around San Francisco. We take a national park ranger, we read a book we have what's called a story walk set up in the park. So we invite families and young people to libraries to read a book together with a park ranger. And then we have a shuttle right outside the door where they can load up their stuff and their gear and go take a walk in the park and read the same story by walking a trail where the illustrations, the graphics, the stories, sometimes the author tell that story together in person with their family and give them that experience that says, you know, getting to this national park maybe isn't as hard as I thought. And it's here for me and I can experience it together with my friends and families.
Oh, I love that. I think when you make something bite-sized where it's manageable and it's giving guidance in that way, and then reliving the book, you've read it, you go there and then you walk it. What a marvelous experience. That sounds like a really great, at least move in the right direction to address some of these equity issues. I also really appreciated what you said, and this is a really perfect lead-in into a question for you, Dr. Beck, about healthy parks and healthy people, and then park prescription. Love that. So Dr. Beck, you have been working specifically on childhood obesity, and when I heard the park prescription, I immediately thought of you in this question that I have around, can you share more about the health issues that the children face in your clinic? You gave us, quite a story there, but changing behavior is hard. And so what changes can the families you serve make, and how can resources through these outdoor spaces bring health equity to our community from your perspective? And how can we connect the dots between the healthcare provider and the park conservancy? And maybe give us a little thinking around that.
Yeah, so I think people have tremendous capacity to make changes, but I think, like you mentioned, that the biggest thing usually is resources that are the barriers. The kids we see are extremely enthusiastic about everything. They want to be, playing on sports teams and going to parks and certainly engaging in any kind of activities with other kids. And so what we have been trying to do over the years and are continuing to refine and expand on is just to make that entry easier for families. So we actually offer our own physical activity program. We call it Healthy Saturdays. I'd say one good serendipity is that we started doing it outside in parks during the pandemic for COVID transmission reasons, but it's actually proven to be having it on a weekend and having it outside has been really successful and really popular. And so I think the other thing that makes it successful and popular is just it's so easy. People they don't have to sign up. They don't have to submit a scholarship application online and with their proof of income and all sorts of things like that and register their child. They, like as Chris was mentioning, something in the library, anything where people can just come and, be there, and it can be very, very easy to access and consistent. We offer it every Saturdays. We sometimes change location if we have a soccer special or, something like that. But for the most part, we try to keep it consistent. And then we also try to do case management to help. Most of our kids would really want to swim. And swimming is such a great sport for kids, and so important also just for drowning prevention for kids to learn how to swim. But it can be very challenging to access those programs. That's one where the scholarship applications can be very challenging for people who are low technology. And so just trying to break down those barriers wherever we can, so that as a well-resourced parent, it's hard to get your kid into these kind of programs and into these kind of experiences. So I think, any way that we in healthcare can really just offer people very easy to access resources, I think is kind of the best way that we can reduce some of the inequities that people are facing, because it's not for lack of wanting your child to participate or lack of wanting to do things, together as a family. It's usually a combination of just, barriers like transportation, and then sometimes simply awareness of what's out there.
Wow. I love the Saturday drop-in. It's like a drop-in clinic, but it's the drop-in at the park. So
Yeah.
that's pretty great because people can absolutely do it on their own time. And as you're saying, just make it work without a lot of pre-planning and sign-ups and such. So in my mind, that's a silver lining of the pandemic, that something wonderful like that has really happened. And so, Chris, that really, leads me to ask you a question, like what changes in the public outdoor spaces have you made during these past 2 years that, you hope will remain and that in fact is a silver lining from your perspective?
Kim, I think one of the changes that we've seen happen is with more people coming to the parks and even people coming from further away, that there's building a sense of belonging in parks. And I think that's been a real struggle, this shift to this feeling that, well, I actually belong, overcoming the barriers that people have to access, whether it's confidence, whether it's transportation or it's distance, that the ability to say, well, it's not just a pretty place, it's a place that I can genuinely and authentically feel that I'm myself. It's a place that I can do the activities that are important to me or to my families. And I think for a long time, national parks have kind of been a faraway destination or thought that if you come to a national park, you have to be a certain way or do a certain thing. You have to be a hiker or a fisher or a climber or somebody who has some deep connection to outdoor experience and capacity. When in fact, we've seen during the pandemic, and a place the Conservancy is moving is we can work with communities near parks to co-create what they want to see, what they want to be, how they want to belong. And I think the belonging piece, that connection to park, that connection to people, that feeling of belonging, it fulfills the piece in us as humans that we need to be part of something bigger. And that's what national parks do. When you stand on the top of tunnel tops and you look out this summer, you're going to see this amazing bay. You're going to see the Marin Headlands. You're going to see across to Oakland. You're going to see, standing on a national park, the same feeling people have in Yellowstone when they see Old Faithful go off. The same feeling when they stand on the edge of the Grand Canyon and think, this is immense. This is so big. And there's something about the enormity of what national parks bring that causes us to see ourselves in a perspective, not that is smaller, but that is more connected. Some people call it awe, some people call it wonder. I like to call it purpose. Just this idea that we find a space in which we believe our connection leads us to do something bigger, greater, stronger than we are as one individual. So I think if we can shift that feeling of belonging to mean that for more people who can come and experience that, that will be a huge silver lining from the pandemic.
Wow, that is inspirational. Thank you, Chris. So when I think of that, kind of the awe, the purpose, but you started with co-creating with the community so that they have a sense of belonging. So when you talk about co-creating with the community, and particularly when I bring in sort of the equity lens, can you give us an example of how that might look? How would that work? And share maybe a story around that or an
Sure.
example?
Yes, we have actually a wonderful first time ever process that we've created. It's called the Presidio Tunnel Tops Activators. And what we've done is we've had some wonderful relationships between the Parks Conservancy and nonprofits all across the Bay Area. And we've learned that the relationships we've built there reach more deeply into communities than we ever could, just as the nonprofit representing the parks. And over the course of the last 8 months or so, we've created a group of, I will call them community leaders, from, Bayview Hunters Point all the way up to Oakland, all the way into Marin County, that represent communities who don't necessarily feel like they've overcome those barriers to accessing the parks or had the inspiration for their friends and neighbors to come into the national parks. So we are paying these folks a stipend to kind of be our consultants, not just to ask them a favor of being a community member to coach us, but to be consultants and work alongside us to say, what could their community benefit from? How could we create opportunities for their friends, colleagues, and community to activate these parks. So before the first public foot steps on the Presidio tunnel tops, we will have spent months with these community leaders, and they're talking to us about what's the language that's used on the signs in the parks, everything from that to we could create an art installation here. We could have a festival here. We could bring our spaces alive with every community member who has an opportunity to tell their story, not just the story of the national parks, how their family connects and how we respect and value people in the park based on what they want to do, not making it in the image of the people who built the park, but in the image of the people who can activate and experience the park. So our Presidio Tunnel Top activators, a collection of people who are extraordinary, who are teaching us so much about what it means to create together, and who will create an entirely new set of experiences on those new parklands.
Okay, great. All right, that is very exciting. So let me just come back to Dr. Beck. And we heard you talk about the new Saturday, or not the new, the Saturday classes in the park. And then we've just heard about these, the Presidio Tunnel Top activators and the consultants to co-create. And so I'm curious, how do you hope families will prioritize staying outdoors as our lives move a bit more indoors, and how do you hope to keep that going?
Well, I think again, just coming back to, I think the biggest pieces are usually sort of access and awareness. And so, we have a big role to play as pediatricians in making families aware of what's out there. And then I think we all together have a role to play in terms of, making access real and sort of, actionable for families. We certainly do a lot of goal setting around physical activity for families, trying to help people come up with things that they can do together with their child. Talk a lot about how I say, like, the first thing to do on the weekends, do your outside time first, because everything else gets in the way. And then, of course, if they're interested in healthy Saturdays, and that can be with us on Saturdays, on Sundays, you're on your own now. But trying to help people to to be motivated and to be inspired and to be creative. But then I think the other piece of that is all of the real barriers that people face in terms of, a lot of our families, one parent is working on the weekends and one parent is working during the week. And maybe it's an older sibling who's taking care of the kids on Saturday and Sunday because the parents, are at work, or there's only one car shared amongst many, many family members and people are using that for work transportation, so we can't really try to promote activities that would require a car. And so trying to see what we can find for people that is more local. So I think, there's just, I do think we are very fortunate in San Francisco. I fully believe that stat that everyone is within 10 minutes of something, which is very different from a lot of other cities. And so it's like an amazing resource that we have. Despite that, though, there are very different experiences that people face and barriers that they may face, particularly for, a lot of kids are very excited about playing a particular sport or having a particular experience, and, trying to facilitate that, I think is also an important role for us to play. Because I think that the more that kids are really enjoying what they're doing and excited about it, sort of the more continuity, they will have. And so they're looking to be outside, but they're also looking for the socialization piece. They're looking for skill development. So I think just there's just a lot of different levels. And, we as pediatricians need to be kind of working on all those levels. We need to be helping people to get motivated and to set goals, but we also need to be breaking down the access barriers so that we're not sort of promoting things that are just sort of out of people's reach.
Great. No, definitely we've got a lot of things in reach here in San Francisco. So thanks to Chris and her leadership and others in the community. So I love how you're thinking about that. we're now going to go to some questions that have come in from the audience. In fact, we've got quite a few. So the first one will be for Chris. What's next on the horizon for Golden Gate Parks as far as its focus? Is it more expansion and creating green spaces? Or is it more on getting folks to enjoy the spaces we currently have available to us? So Chris, I'm going to hand that over to you.
Great, Kim, thank you. Our focus is really moving closer to the connecting people with parks, really putting intentionality that we have had this incredible 40-year run of helping the National Park Service and the Presidio Trust to kind of build overlooks and trails and visitor centers. And now it's time for us to really take the power that we have to work in communities and with communities to activate these lands. Dr. Beck, I think you'll be excited to hear at the Presidio Tunnel Tops, in addition to the amazing views and opportunities there's a brand new natural playscape that is kind of down on Mason Street. There's what's called our Chrissy Field Youth Education Campus, bunch of new opportunities there. We're going to triple the number of youth we can connect with, middle school, high school. But it's this design that was created, and it's all natural materials, and it moves from really young kids, 3, 4, 5, who can play with dirt and mud and crawl through, bricks and, well, they shouldn't crawl through bricks, logs, and find their way in the tactile sense about what is nature and how does it feel and what's it like to be in it. And then it moves through a series of different playscapes that become more complex, more reaching into your physical abilities as well as your mental abilities. And so families can go and take kids of all ages to this location. So let's figure out a way to hook your Saturday experience with these new lands. And I think together, when we bring organizations that connect people and communities and neighborhoods with these places, families find a way to overcome some of those barriers of time. Third graders run the world, right? If a third grader in your family says, mom or dad, or mom and mom, or dad and dad, we need to go down there and do that because it's a great thing to do, families will kind of gather around that inspiration. So at the Parks Conservancy, we're really focusing on this connection, the belonging, and the inspiration that comes from all the ways that health and anxiety and stress and depression can be changed by the connection with nature. So that's where we're headed.
That sounds great. Connection, inspiration, and belonging. Wonderful. Thank you, Chris. So Dr. Beck, here we go. What advice would you give to parents struggling to get their children to be more active and go outdoors instead of playing a video game and, particularly in a technology-based age?
Yes. So full disclosure, I have 2 children, 5 and 7. So, and my husband is Norwegian and they're obsessed with the outdoors. So yeah, we live the struggle. I do think that, sort of trying to remember that, many children are very social beings. And so sometimes like the hike or the walk with mom and dad is much less exciting than the hike or the walk with another family with children of the same age. Because I think that when kids have a little bit more of a group, they just start to come up with all sorts of games and all sorts of ideas of things that they can be doing when they're out in nature that are really entertaining. And if it's, sort of just the parents and the kid, and you're trying to get them to go on a walk, it can almost kind of seem like, oh, they're just humoring you or, but so that's one thing that's at least, for my patients, trying to plug them into group activities, and for my own family, trying to basically make our hiking and our outdoor time, sort of social time, with other families. The getting a dog helps because and having them have some responsibility for that, for walking the dog. But, and then I think in terms of the screen time, it's such a struggle for all of us. And I think the things that seem to help, one is really having a budget that you come up with as a family. So, and that has to include the parents too, because if we're always sort of modeling that we're continually on our phones or continually checking email, and then we're trying to reduce kids' screen time, they really pick up pretty quickly that that there are different roles, and that makes it hard. And so, but I think having kind of family policies around screen time and actually kind of coming up with them together, maybe even writing them down in terms of the amount of screen time, things like no screens at the table for eating, and then having outings that are screen time free. So of course we violate that with GPS on all trails, et cetera, but opportunities to be outside together where there are no screens, I think is good. And then I think also just trying to reflect with your kids on, what are the emotions that are coming up when they spend a lot of time on screens versus what are the emotions that are coming when you're spending time together as a family, you're spending time outside. Because sometimes you see all these benefits as a parent, you see these sort of changes in your child when they're off of the screens and they're outside, but they may not totally notice it. They might not have the self-awareness. And so I think just talking about it together as a family is also beneficial.
Yeah, thank you. I think that's some great advice. I know for myself, when I go out running, I don't allow myself to take any electronics because it's so tempting. It's in your pocket and it, buzzes or it does something and you're inclined to want to look. So that is great advice to try and do technology-free walks and time. And I guess if you need the GPS, you can do that, but it definitely isn't tempting if you don't have it. So thank you for that. Chris, question for you. Transportation to parks is so vital to access. Can you share more about how we can encourage non-drivers to visit our parks? Shuttles, public transportation, partnerships like the library that you shared, that example, sound like a great connection. Is that with all libraries? Are there other options? Maybe what else might you share for this group?
Kim, part of what we're doing is we're experimenting. And so we've actually created a kind of a new approach called our Access Lab, where we want to partner with, companies that move people around the earth, right? I won't name any specific companies, but, can they, as a part of their environmental, social, and governance priorities, provide donated trips to national park lands? Can we activate in ways that public transportation creates more connection? So for example, with the tunnel tops, our partners at the Presidio Trust came into an agreement. Now the 30 Stockton comes into the Presidio. It turns around at Christie Field. It's going to let people off at the base of the tunnel tops. That's public transportation that covers a large range of the city. And so being able to publicize that, being able to make sure people know that that's one of the ways that they can get to the park. As the park lands have been built, we've been adding EV charging stations. We've been adding bike racks. We've been making sure that there's connectivity of trails that go outside of the national parks that may even lead into neighborhoods and be able to bring you into a national park. In Marin City, we have one of the areas in a neighborhood that's right at the trailhead of going into the national park that's on the Marin County side. So these park lands go from Marin County to San Francisco County to San Mateo County, and networks of trails are an important part of that. And we have to make them as close as we can to people, but also overcome that emotional barrier that says it's just too hard to get there. There are people who say, well, sure, it's a beautiful place, but I can find most of what I need in my neighborhood, which is a wonderful feeling, but might be a lost opportunity. So together with public partners, private partners, and on foot and healthy messages, we think we can get more people feeling confident and belonging in national parks.
There's another question, and you just sort of led into it perfectly, about how does philanthropy help with access to public spaces like it does for healthcare access? So you just started talking about maybe getting a private company about buses, and then I heard a little bit there about raising some additional funds. So how can this public-private partnership and philanthropy come to bear?
Well, philanthropy, it plays such an important role. And I think about philanthropy, you break the word down. Words are so important into its components. It's making what you love better. And it's making, in this case, what you love better for others. And so we just actually started our first ever program fund to raise money for the Parks Conservancy for youth education, connections to community, And we have had already a lot of people contribute to the formulation of the priorities for this fund. We've set a $15 million goal over 5 years. We've already hit $5 million. We could not have stumbled into something more generous than the Bay Area. The folks in this community see that access and equitable access and youth education and connection is critical. And part of it comes from the experience they've had, right? If you have had the opportunity to visit a national park far away or a regular opportunity to run through the park every day, you have a sense of what that's meant for you, what it's meant for your family. And so philanthropy, as people experience what they love and want to share it with others, is just a cornerstone. And we believe in some ways untapped for the parks to get into the minds and hearts of people who want to make a difference, who do make a difference, and who will make a difference in access to parks and public spaces.
Thank you. Thank you, Chris, for all of that. Amy, I'm going to come back to you with the final question. And that you shared your Saturday example, and you talked about family walks and trying to get kids, in little groups, which I think all very good ideas. Are there other ideas you have about taking healthcare out of the clinic and into the community that we should be thinking about?
Oh, so many, so many ideas. I mean, I think, we certainly are always excited and looking for opportunities to expand. I mean, for example, our Healthy Saturdays, it's only in one location, so, I mean, a starting example would be offering it, in different parks and different places around the city, so more people can access it, and so that kids can connect to, to different places. And then I also really want to have a soccer team or a few soccer teams. We really, we find that a lot of our obesity clinic patients and also our newcomer patients, our, new immigrants they're really eager to be playing a sport, for the physical activity, but for the social connections as well. And it's so beneficial for them. But again, there's so many barriers to access. And so my dream is that we would just have, kind of again, a very easy entry program that, oh, you're a patient, you want to play soccer. Here's the gift card that you can for your cleats and your, shin pads, and then show up at this time, and we have it to offer. And I love the idea of something like that for the parks too, that, oh, you're a patient, you want to access, we think you need more nature, that we have a pickup spot, and it's this time on this day, and you'll see someone from our clinic there, and opportunities to kind of really scaffold that for people. We find that when we do a lot of referral lists. Here's a list of places, call these places, but again, there's so many challenges, so many barriers, so many technological hurdles to applying for these things, applying for scholarships, getting kids signed up. Parks and Rec, some of the programs are so wonderful, but you can't sign up on your smartphone. You need to sign up on a laptop. And so if you don't have a laptop, that's a huge barrier. So my new thinking is just whatever we can do that's easy access for people. And also, I do think that when it kind of comes from us, a lot of people sort of have a little bit of trust already if they've been bringing their child to the clinic. And so then, you can say, here you go. I also sometimes show up at Healthy Saturdays, not all the time, but, I try to go regularly, and other people from our clinic try to come. And so opportunities for our healthcare providers and team members and medical students to be sort of actively participating, I think is great too, because it builds our connection with families, but it also builds trust in these programs, because they sometimes are, coming to us first. So.
I love you just what a perfect thing, a park prescription, as we talked about earlier. And one of the questions that surfaced was, could doctors prescribe access to parks and give a prescription? It just popped in as you were saying all of that. With free parking pass to the Golden Gate National, parking lots on weekends for families in need to encourage visits. So it sounds like there's a lot of ideas that you have, a lot of ideas that Chris has. And so it's really been a marvelous, expansive conversation as we all think about what we can do with what we've heard today. So we've concluded with our questions, and I wanted to ask if each of you, if you have any final parting thoughts you'd like to share, sort of your final thought you'd like everyone to leave with today. Chris, why don't we start with you?
Well, thank you. I know it feels like we could go on forever, and Dr. Beck and I are going to have to connect because the opportunity for us to continue expanding park prescriptions, it's in 24 states. San Francisco Public Health does a great job. There is just so much opportunity when we work together. You know, this collective impact that we can have, the many benefits that we can grow. I think I would just leave, you know, our folks with, come and join us, you know, come and examine what the opportunities are. A specific invitation, May 7th, we're having a kite flying day at Christie Field to celebrate the 20th anniversary. So the first 1,500 people, free kite, get a chance to get out there and enjoy the wind rather than fight the wind. So May 7th, hope you'll come out. We'll get more information to you, Kim, so maybe you can share that. And also just one last plug, in Marin County, where One Tam is, the beautiful One Tam, Marin County Parks just started the go to the library and check out a state parks county parks pass program. It's happening all over the country. Go to your local library. You'll probably get a backpack, maybe a little set of binoculars, and a parks pass for the day. So these are the things we need to do as we cross over with our different organizations. Thank you so much for the time today.
Oh my gosh, thank you, Chris. Great ideas. Come join us. Collective impact, bringing together all these elements. May 7th, Kite Day, and Library Parks Pass. Wow, thank you. Dr. Beck, any parting comments you would like to add with your lens?
Yeah, so I think, you know, just that central message that that nature is healing, outdoor time is healing, and opportunities for physical activity and for social connection are all really healing for children, for adults, for everyone. And then I think that in terms of thinking about you know, programming and equity and support, you know, as much as we can provide people with resources and break down barriers, I think is where we are probably going to see the biggest impact, you know, and just really trying to take that equity lens to it and recognize that everyone wants these experiences for their children and are really, really delighted to participate when they're given the opportunity. But that, you know, there just still are a lot of challenges for you know, just having all kids really have these opportunities to be in nature, to be physically active.
Wonderful. Thank you. That is great. You know, the central message around the outdoors, that it is healing and it brings us better social connections. And I couldn't agree more. So thank you for that, Dr. Beck. And let me thank all of you for joining us today. And my deepest gratitude to both Chris and to Dr. Beck. And I would like to end with a wonderful quote that I read this Sunday in the New York Times special issue about national parks. And it reads as follows: restoration and recreation, wonder and discovery, solitude and community, and sometimes simply sitting still. Thank you to both of you. Thank you to our national parks, and thank you to our healthcare providers. Have a wonderful day, all of you, our guests who make all of this happen. Thank you for your support.